Today we're going to talk about syphilis, which is a sexually transmitted disease caused by the bacterium Treponema Pallidum. It affects the genital area, mouth, lips, and anus. This disease is acquired by having sexual contact with a person who has syphilis, and it can also be transmitted from mother to child during pregnancy. After the initial infection, the syphilis bacteria can remain inactive for several years and then become active again. The symptoms of syphilis develop in stages, and the symptoms vary according to each stage. Syphilis has 3 stages, which I will mention to you. We have primary syphilis, which is here. Syphilis presents with a small sore called a chancre. The sore will appear where the bacteria entered the body. Most people have only one sore, but there have been cases where some people have several sores. The chancre appears about 3 weeks after having contact. Many people don't notice it because it's usually painless and can be hidden inside the vagina or the anus. Then we have secondary syphilis after recovering from the initial chancre or sore. The person may experience rashes that start in the chest area and then can spread throughout the body. It can even affect the palms of the hands and the soles of the feet. These rashes do not cause itching and may be accompanied by wart-like ulcers that appear in the mouth or genital area. In this secondary stage, some people may also experience hair loss, fever, muscle aches, and so on. If treatment for syphilis is not received, the disease progresses to the previously mentioned secondary stage. And from the secondary stage, it progresses to the hidden or so-called latent stage. This stage can last for years. It is possible that in this latent stage, the signs and symptoms disappear or that the disease progresses. Tertiary syphilis, primary syphilis, secondary syphilis, and latent syphilis. Even in these stages, syphilis can still be transmitted. In tertiary syphilis, it is no longer transmissible. When a person reaches tertiary syphilis, it means they have not received treatment, which is why they are in this stage. In this stage, the disease can damage the brain, nerves, eyes, joints, the heart, and blood vessels, and this will happen many years after the original infection. Some of the complications that syphilis can cause are, first, that it can damage the whole body, as we already mentioned. Number 2, it increases the risk of contracting human immunodeficiency virus and can cause problems during pregnancy. To diagnose it, a blood test is done, and antibiotics are used to treat it. When it's in the early stages, it's very easy to treat and penicillin is used. The treatment will vary depending on the stage the syphilis is in. Always remember to see a doctor, Dr. David Campos.